Okay, so this is a trauma patient assessment. The first step in this skill is putting on proper PPE, which is gloves. And then I'm going to begin my scene size up. So the first thing is making sure my scene is safe, which it is. Then I will determine the, the mechanism of injury, which I have been told is a motor vehicle accident going at 45 miles per hour. And then I'm going to determine the number of patients. I only have one. I am going to request ALS, and because of the mechanism of injury, I will have my partner stabilize the head in a neutral position. And then I'm going to begin my primary assessment. So the first step is the general impression of the patient. So here we have a 35-year-old male laying supine with his eyes closed. And then I'm going to check his consciousness. Hey, are you okay? So the patient does not respond to verbal stimuli. Next, I am going to inflict pain on the patient to see if he responds to pain. The patient does not respond, the patient is unconscious. The next thing I'm going to do is just look for any obvious life threats that I can treat. So here we have some major bleeding from the patient's arm. So I will stop the bleeding by applying a tourniquet. And I will apply the tourniquet 2 to 3 inches above the injury. And make sure it's tight enough so that the bleeding stops when the circulation is cut off to the extremity. So the next thing is I'm gonna assess the ABC. So I'm gonna start with the airway. So I'm gonna open the mouth to check for any liquids or any objects that are obstructing the airway. There seems to be none. And then I'm gonna check the patient's breathing. So he has equal rise and fall of the chest and it's adequate. So I do not need any airway adjuncts. The patient seems to be breathing fine. The next thing I'm gonna do is I'm gonna assess the patient's circulation by checking his pulse. So I'm just like a quick way to check the pulse. So the pulse is weak, but it's fast. I did not get the full measurement because this is just a primary assessment. Next, I'm going to assess the skin. So it's pale, cool, and clammy. He is diaphoretic. Therefore, I'm going to put him on oxygen at 50 liters per minute. And I'm going to treat him for shock, which means that I will transport him supine and make sure that the patient is warm. And here I've already treated the bleeding. And I have finished with my primary assessment. So next, I will start my secondary assessment. So I'm gonna palpate the head for any obvious deformities or hematomas or any skull injuries. So there seems to be none. Next, I'm gonna inspect the ears, the mouth, and the nose for any blood or cerebrospinal fluid, and there is none. And now I'm gonna assess the eyes. So the eyes are, the pupils are equal and reactive to light. Next, I'm gonna check the patient's neck. There is no tracheal deviation, jugular vein distension, and now I'm gonna assess the patient's cervical spine for any off bones. There's none. Next, I'm gonna inspect and palpate the patient's chest. So I do feel the equal rise and fall of the chest. And I'm gonna also check for any broken ribs, which there is none. Next, I'm gonna auscultate the patient's lungs. Okay, lung sounds are normal. Now I'm gonna check the patient's abdomen for any tenderness. So the patient's abdomen is soft and non-tender. I'm then gonna check the pelvis. So I'm gonna push in and down. So the patient's pelvis is stable. I'm checking the patient's genitalia for any priapism with the back of my hand. And now I'm gonna check the lower extremities. So I'm gonna palpate and inspect both of the legs for any deformities. So there are none. And now I'm gonna check for motor, sensory, and circulatory functions in the extremity. So there is a pulse in the lower extremities, and I cannot access the motor and sensory functions because the patient is unconscious. I am gonna do the same to the arms, checking the arms for any obvious deformities. And now I will access the circulation. So there is a pulse in that arm, but obviously there's no pulse in this arm because I've cut off the blood supply to control the bleeding. And now I will have my partner, which is holding the head, count to 3 while we lower the patient so I can check his back and place him on a backboard. So my patient's gonna count, and my assistant is gonna count, and we're gonna log roll him. Okay, I'm gonna check the thoracic spine for any deformities. I'm gonna check the lumbar and the buttocks, and now I'm gonna place him on the backboard. And I'm gonna verbalize placing him on the backboard, and I will transport the patient. He is a critical patient, so he's gonna need immediate transportation. I will continue giving him oxygen. I'll make sure that the patient is warm, and I'm gonna reassess every 5 minutes because he's a critical patient by rechecking his vital signs, redoing my primary assessment, and making sure that there are any life threats in the patient. That's it.